It's really important to work with individuals with a learning disability around the vaccine programme, because before COVID came along, individuals with a learning disability have a shorter life expectancy, and they also present often with complex physical and mental health needs. So they're vulnerable anyway. And then COVID came along, and research last year showed that individuals with a learning disability who contracted COVID sadly were 4 to 6 times more likely to die from it than individuals without a learning disability. 18 to 34-year-olds who had a learning disability and contracted COVID-19 were 30 times more likely to die from it. So initially, from the get-go, it's so important that we are supporting these individuals because they are more vulnerable to it. And there's no clear reason as to why exactly they're more likely to die. There's not one reason in particular, but it just makes the purpose of finding a way for them to receive the vaccine much more important.
When we first found out about COVID, there was, we were really scared for our client group. And I remember even going shopping, I remember queuing up for a long time. And I thought, oh my God, those ones with mild learning disabilities, if they're going to go shopping, how they're going to line up, how they're going to keep their distance. So, that there was fears right from day one for me and maybe for my other colleagues as well, that this client group, some of them may not have that understanding of what COVID is, what they need to do, what actions they need to take. There was right at the beginning for all of us that worry in order to keep them safe, and how do we keep them safe? Yeah, that was always there. And then for me, when it came to the vaccinations, I knew there was going to be people that we're not going to be able to vaccinate, and we were going to struggle. So there was that sort of fear as well.
So what we did in Hounslow is we identified those individuals who were struggling to access the vaccine because they might have had a fear of needles or of the vaccine itself. That may have come from previous medical environments where it was quite traumatic for them, or they might have a high pain or a low pain threshold, or they might just not understand why they need to get the vaccine. We devised a program that basically broke down what the steps of the vaccine involve. So for you and I, we come into a room, we sit down, we know someone's going to come, give us the vaccine, and then we'll leave. It's very straightforward. But you actually need a number of prerequisite skills to do that. So you need to be able to sit for long enough to receive the vaccine. You need to be able to tolerate someone touching your arm, touching your deltoid muscle. You need to be able to tolerate medical people in the room or medical equipment around you. So there's a number of things that we need that you and I might naturally have that individuals with a learning disability may struggle with.
Before we even go, we've sent information, easy read information to the staff. We've spoken to the staff prior to going, doing a reinforcer assessment, seeing what they actually like as a reward, and then using that information when we do the desensitisation programme.
We worked through each step in the programme, and only when someone mastered the first step did we move on to the next. So the first is simply building rapport, becoming comfortable with a nurse in the room, seeing the nursing equipment, the needle box. That's the first step. We don't show anything. The second is you come in and maybe we start working on tolerating touch. Again, we don't show the needle, but when they do these basic steps, we provide them with loads of praise and access to their preferred items so that we're re-associating that negative link that they may have had to needles. We're trying to re-establish a positive link to that.
And some of them actually quite liked sort of like a cheer and a clap and, saying well done and a lot of praise. I mean, that worked for some individuals as well. So it was that sort of stuff, information you needed to get prior to starting the programme, knowing what really works for them. If it is a lot of sort of a chair and encouragement, and that's what we gave them at the end. And there was one individual who I was told, you're not going to get it done, and I said okay. They said, oh, the GP's tried and we've tried to take him to the GP, we've not been successful. So in my mind already I thought, oh, I'm not going to be successful here. I'd already made that decision as well, because I was relying on the staff because the staff know the service user. But anyway, I thought, well, I'm here, we're going to give it a go. But however, the PBS worker was saying, we might be able to do it, And then I just did it. And I was absolutely gobsmacked that we managed to get it done when we were told by staff there was no way in hell that you're going to get it done.
So at the moment there's 3 positive behaviour support practitioners and 3 nurses that are allocating a chunk of their week to this programme. And because we're working with an adult population, the learned history of the fear often is much longer. So we might be working with someone who has had a fear of needles for 40 years. And that's going to be a longer piece of work in nature than someone who is 5 years old who has a fear of needles. So at the moment what we're doing is we're allocating 3 hours on Monday, Tuesday and Wednesday each toward this programme, and which has been fantastic. We've seen great success in it, but also one of the repercussions to that is that that's clinical time that we're not spending on our other caseloads that we each individually have. So what that means is trying to navigate priority and diaries and ensuring that we're not missing clients who definitely require our attention urgently.
They're no different to you and I. They deserve the same vaccine that we do, and they need to live just like you and I do. So yeah, it's important. I mean, people are dying, basically. This is it, isn't it? They're COVID and they're dying. We don't want that for them. We want them to have a healthy life and live on and have the same chances and opportunities that you and I have in life.
When it comes to getting the COVID-19 vaccine with the population of people that we work with, it can be a case of life and death. And so clinically it is urgent, it is really important that we do allocate this time, because we are better protecting some of the most vulnerable in our society, which we do have a responsibility to care for.
I'm so happy that I've been given this opportunity to do this. It's something that I'm going to have with me for the rest of my life. Even if I'm not a nurse anymore, I will retire one day eventually, but it'll be always there with me that I played a part in helping people with LD, that I've supported them to have their vaccine. Yeah, it does make you feel proud that and happy that these individuals have had their vaccine and you've played a part in it. Yeah, definitely.
It's when we make a programme bespoke and we go into someone's home and it's individualised to their needs, they are more likely to succeed. And what the ripple effect of that is, the people who are supporting them see, hang on a second, if we make small amendments here, we can better support the individual that we're working with, or we can better support our son or our brother. And yeah, absolutely, what the ripple effect of that is, if they can succeed in this area, where else are there potentials? Where else can they succeed that we may have put a glass ceiling on? So there is a ripple, there's a learning in it for everyone, that actually individuals, they have the possibility to far exceed any of our expectations. It's such an honour and a privilege to work with individuals with a learning disability, and to be part of a team that work to uphold them and respect them and enable them is a real privilege. And that's why we do what we do, because it's supporting the most vulnerable in society. It's essential to our community, to the greater human good. Yeah.